Happy New Year, dear viewers, and welcome to today's session. This is year 2026. We will be looking at what are those scientific breakthroughs that we are expecting in year 2026, based on the fact that many of these scientific breakthroughs have been in the process in the previous years, and we are expecting them to meet state of maturity and some of them to meet a state of large-scale production for the public consumption. So today I have selected some top prioritized scientific breakthroughs we are expecting. So join me in this journey as we explore some of the expected scientific breakthroughs for the year 2026. So we'll be starting with the cancer therapy, which is a very good news. The medical intervention to the cure of cancer is not just one. It includes the surgical process, which is the removal of the lump. After that, it includes chemotherapy, radiotherapy, among other medical intervention. But there is no particular one solution that fits everything up. So apart from the surgical process, other medical intervention to the treatment of cancer has a lot of side effects on the patient. And so the scientific community has been interested in looking for, if not a one solution, but at least more effective solution towards the treatment of cancer. So cancer treatments, which include chemotherapy, radiotherapy, among others, has been often been asked, and there is no one size fits all to the treatment of cancer. So the major challenge of these medical interventions or the existing medical intervention is that they attack the body cells itself. Take for example, we have the body system of the patient that has these triangles happen to be the good body cells that actually build the body system and fight against the disease in the body. Right, so when cancer cell is introduced to the body, let's say this is cancer cell, right? So the cancer cell tend to attack this the good cells in the body. So in the introduction of chemotherapy, which is an injection, when chemotherapy is injected to the body, what it does is that it tends to kill these cancer cells, right, and also tend to kill the good cells in the body. And so it comes with a lot of consequences or challenges to the body, which include loss of weight, loss of appetite for food, loss of hair, among other consequences. So a cancer vaccine is to be made especially for one person to help the body fight against the cancer cells only. So what this vaccine is expected to do is to fight only the cancer cells and leave the good cells alone without fighting the good cells. So in this year 2026, we are expecting a cancer vaccine that will be able to specially fight the cancer cells only without fighting the good cells in the body. Currently, this vaccine is at the phase 3 of the clinical trial, and we are expecting that in the year 2026, it will receive the approval. And between 2026 and 2027, it will have the approval of the authority, necessary authority, the medical authority, and it will be able to go in mass production. We are expecting companies like Biotech, Pfizer, Moderna, and GSK to, once the approval has been given, for them to go into the mass production towards attending to the cancer patients. And how will this be done? Once the cancer vaccine has been approved, the doctors, through medical process, will get out the lump from the body of the patient. Then there will be a study on it to understand the characteristics of the protein of the cancer, and those characteristics are what will be used to program the cancer vaccine. So the cancer vaccine will be making use of the mRNA technology. The mRNA vaccine technology has the ability to study the protein, and it can be reprogrammed. So the doctors will have to reprogram this mRNA based on the characteristics of the protein that has been studied from the cancer from the patients. Right now, once this mRNA has been programmed based on this protein, then it will be injected into the body of the patient. Now, if we have this mRNA here. Now, this mRNA will be able to identify the cancer cells, attack the cancer cells, kill the cancer cells. It will also be able to train the existing body immune system such that not only the mRNA can identify the cancer cells, but the body immune system also will be able to identify the cancer cells and will be able to remove the cancer cells. With this, there will no longer be the challenge of chemotherapy or radiotherapy on the patient, and we expect that the number of patients that died as a result of cancer will be to a very minimal level. We are expecting that this cancer vaccine will start with the skin cancer, right, and the pancreatic cancer will be addressed first. So, year 2026 is bringing forth a very significant good news to the medical world for us. Another very good news we are expecting from the scientific community in the year 2026 is the traveling of human to the moon, around the moon, after the Apollo successful mission. I have once said this in my previous video, so if you have not watched my previous video about Artemis II, kindly do that, how you can travel with Artemis II. So precisely in February 2026, next month, we are expecting Artemis to travel around the moon. Currently, after the Apollo's mission, human being has not traveled to the moon after the Apollo's mission in 1972, which is over 50 years now. So modern spacecraft system for deep space human travel has never been tested for astronauts on board to travel to the moon. So it is expected that to land human beings on the moon again after the Apollo's mission, NASA must prove that astronauts, human beings, can safely survive in deep space travel. So we are expecting that Artemis II will send astronauts to orbit around the moon, to move around the moon, not landing on the moon without landing, as a critical test mission on February 2026, that is next month. It will be the first crew flight of NASA's Orion spacecraft. Orion spacecraft is this latest spaceship that has been developed to travel to the moon, and this will go beyond the Earth orbit. So this is the Artemis II team that will be traveling around the moon. So this is the team lead, and that is Wiseman. This is Victor. Victor is the pilot, and Victor is the first black man of color that will be traveling around the moon. This is Christiana. Christiana is Artemis herself. She is the first female to travel around the moon. And this is Jeremiah. Jeremiah is from Canada, which signifies international collaboration in NASA's team or mission, NASA's mission to the moon. We expect that the team will be leaving the Earth. Let's say this is the Earth, right? And this is the moon, right? We expect that the team is going to leave Florida. They will have a launch in Florida, in US, and they will move around the Earth this way. Having completed at least 360 degrees, then they will go this way, change this way, travel around the moon, orbit around the moon, far behind the moon, and here they will be redirected back to the Earth here, and eventually they will land in the ocean in Florida in the United States. So they are not landing on the moon yet. They are only orbiting around the moon just for NASA to test that there can be safe survival of human being in the deep space travel. So we wish them a good luck. Watch my previous video on this. You will see how you can join the team by registering on NASA website, and your name will travel along with this beautiful team down to orbit around the moon. All right, ensure you check my previous video on this. Another very significant scientific breakthrough we are expecting this year, which will be having a mass production this year, is the renewable energy storage, precisely the battery. This time around, the existing battery has been using the lithium ion, and this has lots of challenges attached to it, including the cost of production is very high, access to the raw materials, and itself after production, it has a short time of sustaining or retaining power. Hence, the scientific community is moving away from lithium ion to sodium ion, among other new materials that we use to store the renewable energy. So currently, the renewable energy like solar and wind energy are commonly stored in the lithium-ion batteries, which is the LIB. And the challenge is that these batteries are quite expensive because the raw materials is quite expensive and not easy to access. It also has a challenge of fire risk. It relies on scarce raw materials and it is quite expensive. This raw materials is very, very expensive. It also takes time to charge and it struggles to store power for a long period of time. And because of these challenges, scientific community has done a lot of research to have a superior replacement to lithium ion, and that is sodium ion, among others. So it is expected that in the year 2026, the new battery types, which is now the sodium ion, will be the new battery type. So we'll be using the common materials like sodium ion, zinc, water, and air, right? The one that has just been completed as at year 2025 is the sodium ion, which has been completed. So for others, in terms of zinc, water, air, metal, steel, they are still in progress. So this will be reaching the large-scale production and use in different countries. We expect that the metal air batteries, zinc air batteries, sodium ion batteries, zinc ion batteries, and the magnesium ion batteries will be a proper replacement to get over all these challenges of the lithium ion. So we expect companies like CARS, which is from China, AMTE Power, which is from UK. We have a Artemis AB company, which is from Sweden, to do the mass production. We expect the lithium ion battery to be safer, cheaper, hold power for a long time, and to be more stable. So more especially looking at the high-tech technology that are coming up every day, every now and then, we need batteries that are able to keep the renewable energy and be able to supply all this high-tech technology. Again, congratulations to us and a big thank you to the scientific community for this breakthrough. Another very significant scientific breakthrough for the year 2026 is the prime editing, which is the editing of the DNA using the CRISPR 2.0. Currently, some serious diseases among human beings are caused by tiny mistakes which are observed in the genes, like one wrong letter in the gene. And before now, CRISPR 1.0 has been developed as a gene editing tool for fixing of problems related to gene. Unfortunately, CRISPR 1 often cuts the DNA, which because of solving a problem, it has created a problem again, and not just a small problem, even a bigger problem of cutting the DNA. And so it is necessary for doctors to fix the genetic mistakes without damaging the healthy DNA in place. And so in order to address this challenge, CRISPR 1.0 has been improved based on research to CRISPR 2.0, which is the prime editing itself. Now, what CRISPR 2.0 does is this. Let's assume we have a textbook, right? A textbook from page 1 to page 20, and it is observed that on page 5, let's assume this is page 5, there are 2 lines that there are mistakes in page 5, and this mistake will lead to misinterpretation of the whole chapter. So what CRISPR 1.0 did was to unbind this book, remove page 5 from it, then discard it, print another page 5, which mistake has been corrected there, then bring it back to the textbook, then bind it again. That's a typical demonstration of what CRISPR 1.0 did. Now, CRISPR 2.0 says you don't need to unbind this book again. All you just need to do is to identify page 5 where there is a mistake, then come with a hand printer, use the hand printer to clean the mistake of 2 lines and print the correct sentence or sentences on that page 5. As a result of that, there is no need to unbind the book before correcting the mistake from the textbook. That is what CRISPR 2.0 has done, which is far more improved than CRISPR 1.0 as against editing the headly DNA. So the solution is that prime editing, which is from CRISPR 2.0, can correct single genetic mistakes with high accuracy by carefully rewriting the exact letter that is wrong and not cutting the headly DNA. So CRISPR 2.0 is like doing a find and replace approach, right? Such that we can automatically find the DNA that is faulty, then we automatically replace it without cutting or tampering with the headly DNA. So it is expected that in the year 2026, the clinical trials for prime editing are expected to show a success in treating diseases like sickle cell anemia and the Tay-Sachs diseases, which these are the pioneer diseases that the prime editing has been used to address in the clinical trial. So companies like Prime Medicine, companies like Editors Medicine are expected to come up with the mass production of the prime editing. Again, this is a big success in the scientific community. Thank you to the scientific community. We expect more of this. Thank you for watching. Also ensure you watch the part 2 of this video. Endeavor to like this video, share this video, and subscribe to this channel.